welcome back F3 Omaha to Between Two Coupons with your boy Skids, Greg, and
D-Hum 39 Escobar. And we have a special guest today. Trisha, you want to maybe give your name and where you practice?
Sure. My name is Trisha Holtgren, and I am a dermatologist at Dermatology Specialists of Omaha. We are on 96th Street, just north of Dodge, and we have a new office opening on 204th Street in Elkhorn in September.
That's we'll talk more about that later, but as a person that lives on 204th and Q, I'm super excited to hear that.
Yeah.
Great opportunity for myself and my boys. I have two boys with atopic dermatitis, so
Oh, yes.
I
We
think
see
we
a
could
lot of
talk
that.
yeah, we should talk more about that in the future, but just real quick, so F3 stands for Fitness, Fellowship, and Faith. Sorry for the dogs. We have five core principles. We are always outside, free of charge, open to all men. We're led in a rotating fashion, and we will end in a circle of trust. So, Skids, maybe you want to talk a little bit about this episode?
yeah. So to catch everybody back up, we've been doing a men's health series. So for the 35 people that watched that first one, primary care, thank you. And we are dropping the dental episode here soon. And what we want to do is kind of go through some educational series here the rest of 2023 of things that maybe men don't take good enough care about. And the group does a pretty good job of exercising and hanging out and working on our mental health, physical health, but maybe the physical health. There's some of us that just haven't embraced, healthcare and don't take advantage of free screenings and things like that. So we wanted to start going through the different kind of things that men should look for in the middle age, and dermatology and skin, health is maybe something that people don't think of right away. So Dr. Holtgren was awesome enough to agree to come join us for a few minutes here and kind of talk about that and things to look for. So um, would you like to introduce yourself, a little background on where you went to school and,
Sure.
Omaha
Yeah.
home, and then we can get
Yes.
into yeah.
Yeah. I'm actually an Omaha native. I went to Elkhorn High School back in the day when there was one high school and graduated in 1998. And I went to Iowa State for undergrad. I thought maybe I'd want to be a veterinarian, but I changed to people instead. They're easier to take care of. They can communicate. And then I went to UNMC for medical school. And then back then, we did not have a dermatology residency in Nebraska. So I went to Loyola in Chicago for that. And then came back here when I was done and started practicing. And so I think I've been in practice 13 years now. So going on my 14th year. So.
You
Awesome.
know, I, I think we want to make sure that this is super inclusive of all people who are from different backgrounds. Tell us a little bit about like what does dermatology all cover? Like, so what do you most commonly see in your practice?
Yeah, I know. There's a wide variety of things. So we see, kids and we see adults. We see medical conditions like acne and atopic dermatitis and blistering skin conditions and psoriasis. So there's a lot of medical skin conditions that we treat, some that are serious. And then, we do a lot of skin cancer screenings. So probably half of my day is doing full body skin checks on people to assess for skin cancer and then follow-ups on people that have had skin cancer, just making sure that they're not getting new ones. So I see all different skin types every day. There's certain skin types deal with certain issues more commonly than others. And so it's just a wide variety of things that we see every day.
As far as screening percentage, if you just broke it up men, women, on the screening side, not when it's so bad that I have to see somebody, but people kind of getting ahead of the ball. Is it pretty heavily skewed to female, or is it pretty even? Like what?
I mean, I think it's probably at least 60% women, 40% male, or maybe even 75% women. Men in general just are not as, prone to go get screened for things. And so we see that a lot, that if a man does come, that either their partner made an appointment for them or their primary care doctor kind of said they had to go in. And it's just men don't come in on their own accord very much. So but once they're in the door and they realize how easy it is, then it's easy for them to say, okay, I'll do this. I'll come back once a year to get screened, that kind of thing.
It reminds me like just the practice of medicine is really evolving. It's really changing, like how patients seek out care. Whether it was in the old days, it was like a GP refers them out to a specialist. That's evolving over time, right? Whether that's a function of just social media or a function of just the internet. Like, what's the most common way that patients find you, and what's your preferred method?
Yeah, mostly it's a referral, like from other people. Dermatology is a little different. Like a lot of people come without a referral from their primary care doctor. They just have a skin condition and they want to be seen. And so, we take most insurances, but we even do like self-pay. So like some people don't have insurance and we'll still see them and we kind of discount it. So everyone can come in to be seen. Um, so it's a little easier than I think it used to be, where you always had to have a referral from your doctor to see a specialist per se. It's so easy. You just call and make an appointment, and our billers help with like all the insurance side of things. But it's a lot easier than you would think. I think that's sometimes part of it is like the red tape. People are nervous about insurance and all of that
Hmm.
coming in.
What's an average time to be seen if you just want to come in anyone
Um,
in your practice?
well, so if you want to get a full body skin check, the wait is longer. So it's probably, if you're a new patient, it's probably maybe like 8 to 12 weeks. But if you have a focus, like a problem focus, like say you have a mole that you're worried about, we try to get people in sooner for like changing spots or of
Mhm.
concern. So usually you can get in with like within a week or two for like a
More
emergency.
serious thing. Okay.
Yeah.
You
So
know,
yeah, I mean, you talked about a ton of conditions, and I know D is probably on there too. But what if you looked at skin cancer, like what's the wide variety, or what are some things that we can check at home, and then what
Yeah,
are things
sure.
that
Sure.
you
So
kind of notice?
yeah, so basal cell skin cancer is by far and away the most common type of skin cancer, and it's actually the most common type of cancer worldwide. 1 in 6 Caucasians will get one, so it's
Hmm.
definitely seen in more fairly complected people. But that's not to say Hispanics and African Americans and Asians can't get basal cell skin cancer, but we do see it more in fair skinned Caucasian people that have had a lot of sun exposure. So the biggest risk factors would be your skin type. So we have kind of a scale of like if you're a type 1 skin, that means you always burn, never tan. Like think of like a redhead, they'd be a very high risk. And then like a type 2 skin would maybe be you might be a type 2, Greg, maybe a 3, between 2 and a 3, and
Borderline.
I might be a 2. So like a blonde that like burns but then tans and then and so forth, so on and so forth. So that is what gives you your most risk is how fair your skin is, but then how much sun exposure you get. And so a lot of people, we have a lot of farmers that,
Hmm.
have had sun exposure every day for many, many years. And so they have big risk factors with the sun exposure they have and the fair skin. Um, People that, like don't have any hair on their head, like, so if you came into my office, I'd be really concerned about your scalp. I mean, when, because that's a really common area for a man to get skin cancer, to get basal cell skin cancer is on the head and neck area. Um, and so we check that area pretty regularly and pretty thoroughly. But what to look for at home for like a basal cell skin cancer, it often looks like a sore or even like an acne type blemish on your face that just doesn't go away. So, if you have something that looks like a pimple that stays for several months or then occasionally will start to bleed, that would be a sign that you need to get that checked out.
Hmm.
Now, that's usually on the face. If it's on the body, it often can be just like a pink, kind of like shiny spot, like usually less than a dime size. It could occasionally bleed too, and they just don't go away. So usually, if you get like a pink spot, it might be like, say, it's on your shin. Maybe you bumped your shin on the dishwasher and it goes away. But if you have it like a pink spot that's just not going away after several months, it's good to have that checked.
One of the things that we're trying to do is to create awareness around just like what does the process feel like? Like, what is the screening that occurs just to take some of the stigma, maybe perhaps even the fear
Yeah,
associated with getting screened. So, do you
yeah,
mind talking through the process a little bit?
sure. So if you say that you want a skin cancer screening, usually that's called um, total body skin examination. And so you would take off all your clothes except like your undergarments, and then you'd put a gown on. And so we'd look at everything. Now, a lot of men like to do a waist up skin exam because that's their comfort level. And so you can actually say, I only want to have my exposed areas examined. Like you could say, this is my first visit. I just want my face and neck and arms looked at. So you can specify like if you don't feel comfortable doing a full skin check. Um, Most men, most of the sun damage is from the waist up.
Mm.
So, and I'll talk about melanoma for a second. That's the cancer that comes from moles, and that's one of the most serious forms of skin cancer because it can travel through the body if you don't catch it. And with men, the most common spot for that is on the back. So the back is a big area that we look at in men too. So a waist up skin examination often will get most things, but if you're really active and you exercise outside, and like if you're a cyclist, for instance, I see a lot of skin cancers like on the legs of men that exercise outside because you're getting a lot of sun on a regular basis wearing shorts. So the legs are an area that we tend to not wear sunscreen because it doesn't burn as easily. So it's easy to get skin cancer there.
So do you have to get sunburn to get basal cell or melanoma, or can it evolve? Like if you're like, oh, I've always worn sunscreen, I've never got a sunburn. I hear you
Um,
get sunburn 20 years later, something pops up, but
I
is that
mean,
really?
so most skin types that are more fair burn more easily. So if you're going to get a basal cell skin cancer, chances are you've had sunburns. It's just kind of more common, but
Hmm.
I would say that's not like a totality thing. Like, yes, you could probably still get basal cell skin cancer without having sunburns, because it's related to kind of like your cumulative UV exposure.
Okay.
And then just getting into the science a little bit, it's basically UV damage causes mutations in your DNA. And so it happens over and over and over again. And, finally, your body's repair mechanisms get overwhelmed, and that's when a cancer forms. And that's kind of like in every area of your body, but in the skin too. Eventually, you can't repair that DNA damage from the sun, and then you get skin cancer.
So what does treatment look like? So DHUM comes into the practice. I've been noticing what's potentially basal cell carcinoma, and you diagnose it. What happens then?
Sure. It kind of depends on the location. If it's on the face or the neck, we use kind of a tissue sparing procedure called Mohs surgery, Mohs. And so that's done by our fellowship trained Mohs surgeons that work in our office. They
Hmm.
basically take out the skin cancer kind of layer by layer, almost like in a disc shape. And then they look at it under the microscope that same day when you're kind of waiting for them. They'll look at it intraoperatively to make sure that the margins are clear. And so that way they can take as little skin as possible so that you can maintain like the contours of, say, like your nose or your ear or your lip, so the scar is as small as possible. Now on the rest of the body, like say your back or your arm or your abdomen, we can we can take out skin and put it back together and not have that same cosmetic problem. So usually insurance won't cover that procedure on the body. So we'll do something called an excision where we just kind of take a safety margin around the skin cancer spot and put stitches under the skin and on top. And so you'll have like a linear scar. And both of those procedures are like local anesthetic. You don't you're not put under, so they're relatively low risk.
Yeah, I was surprised, just speaking from experience, had a little spot on my back with basal cell and little scrape and cauterize and a bandage.
Yeah,
And
and that was a superficial one. So if you have a really superficial skin cancer, we get to do an even easier procedure where you just kind of do a little scrape and burn, and you get a little oval type scar, and it's even more simple without restrictions.
yeah, I'd say it's just really itchy. That's it.
Yeah, yeah. But you can work out. That's why I like being able to do that type of procedure because if you put stitches in, then you're really limited for like 2 weeks on like exercising and that kind of stuff. So
And
You know, when I think about the men that are in our group, we do have quite a few that actually work out in the afternoons. Most of the guys are working out early mornings, and so the sun's not quite out. But for those that are maybe cycling or running late at night, any recommendations in terms of like protection that we should be leveraging to warrant ward off some of these concerns?
sure, sure. Well, yes, obviously, if you can not exercise during peak hours, that's ideal. Like avoid between 10 a.m. and 3 p.m., which, in the summer in Nebraska, you don't want to work out then outside anyway. It's kind of miserable. But SPF is super important, and you just have to find one that doesn't burn your eyes when you sweat. That's one of the things about some of the chemical based sunscreens. They can kind of, I feel like they'll burn the eyes more easily. And so I
Mhm.
like the physical or mineral based sunscreens are zinc and titanium based. And so they typically don't irritate our skin as much or burn the eyes. But if you can just like put that on like your face and your ears and your arms before you go out, well, your legs too, technically, especially if you're a cyclist, because like I said, the distal thighs, I see tons of skin cancers in
Hmm.
cyclists. Can always tell if I have a skin cancer there in a man, I always know they're a cyclist. It's just that's where they get skin cancer. I need to do a study on that, but yeah, so put sunscreen on before you exercise. And if you're exercising for like an hour, you don't need to reapply it. I mean, one time is good. But yeah, that's the biggest thing is try to wear sunscreen. I'm going to have a harder time convincing people to wear like sun protective clothing when they're exercising. I think, like you probably wear as little as possible just because it's hot. But if you can wear like a t-shirt, that's great. Like they have the UPF shirts that you can
Mhm.
get like at Dick's or Shields or those kind of places that protect. They block out like 97% of the UV. So that would be good if you're exercising during peak hours.
So this is
All
a
right.
real deal, I guess, huh?
Yeah, they're great,
Not a
especially if
marketing
you're on
gimmick.
like a boat or if you're at the beach. Those are really good to buy one of those shirts to take along.
So this is maybe a selfish question because I'm thinking specifically about my wife as we travel to like Cancun or wherever. What do you recommend in terms of like we get to the pool 8 o'clock and we're there from 8 in the morning till 10 at night. How often should I be applying sunscreen? Like, what's your recommendation to protect myself?
Yeah. Yeah. So, I mean, the kind of the classic answer would be like you have to reapply it every 2 hours because you're going to sweat it off or you're going to get in the pool, that kind of thing. But I mean, if you're a fair skinned person like myself, I have to apply it really like every hour. And if you're in and out of the water, when you get out of the water, you should reapply it. And you should use the lotions. The sprays just don't work as well. I see
Hmm.
patients all the time where, they spray it on and they miss these large areas and they just get a terrible, terrible burn in like a large area, like right by their swimsuit, because they just don't spread it out. The spray sunscreen is better than nothing, but by far and away, the lotions work so much better.
Hmm.
And tell your wives, like, put the sunscreen on naked before you put your swimsuit on, because then you won't have to worry about getting it like getting your swimsuit stained, because that's helped me a ton. So I
Oh
don't
yeah.
get like strips of skin where I didn't get my sunscreen.
Mm.
So I always put it on before I put my swimsuit on. And then of course the reapplication part is a little trickier, but um, that's what we see. Like when people come into my office and they say, "Well, I put sunscreen on." Usually the problem is that they don't reapply it, and then like you're in Cancun and you're drinking and like you forget, and like the sun is so much more intense, and so that's when you tend to get those bad burns. And interestingly, melanoma, that's the worst type of skin cancer you can get, right? That is strongly associated with intense intermittent sun exposure. So, like the sun that you get when you're on a vacation,
Hmm.
it's highly correlated to that. So, you really want to be good about your sunscreen when you're on a trip. And I always tell patients just bring one of those shirts along because you're going to get fatigue of reapplying, 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 so that you can throw that on at, say, like 3 o'clock, 2 o'clock. So you don't have to keep putting the SPF on. But it's so important when you're in a like really intense sun destination or on the water when you have that reflection. Um, so I would say for someone that's really pale, try to put it on every hour. Like you could put it on D like every 2 hours, you'll be fine. But Greg and we wouldn't be. We
Not
would be
fair. Just gotta buy,
probably.
okay, I gotta buy lotion, and I have to tell my wife the doctor said I have
You
to
have to
help
put
her
it
put
on
on
naked,
sunscreen naked. This is great takeaways today.
right?
No, no more sprays, man. It's just lotions only now.
Let me help you get all those parts. Um, well, Dr. Holgren, you got some really good pearls here. Is there any other like main takeaways or things that you'd like all these guys to know that are thinking about this or haven't really taken it
Sure.
seriously?
Well,
Or
and wear a hat. Like wear a hat. Please wear a hat. One that covers like the bucket hat is better than a baseball cap. Like just get the little one that can cover your ears a little bit, because men just get so much skin cancer on their scalp and their ears. When especially as you get older, like the 60 and 70-year-old men, that's a really
Cheers.
high traffic rate for skin cancer is the head and
Giant
ear.
cowboy hats, like big old
Yeah,
sombrero.
yeah.
Okay.
Well, yeah, and like those bucket hats are more popular now.
Hmm.
And then look for, so moles are the things that can be more deadly, right? So look for something, well, have your spouse, because you can't look at your back again. Have your spouse look at the back of you, and vice versa. You look at them. If there's a dark spot that's standing out to you that looks different than the other spots, they tend to be more flat. They're not usually raised. I feel like that's a misconception. A lot of people think if a mole is raised, that it's more likely to be skin cancer. But typically, melanoma starts like a dark and flat spot.
Hmm.
So it can be like two-tone, kind of asymmetric, have kind of irregular borders, or have like several different hues of color in it. So that's what you want to look for, especially on your spouse and vice versa, because that's the skin cancer that can travel through the body and be more deadly.
Well, D, any final questions?
No final questions, but just super grateful for this topic. And, for the guys sitting at home, hopefully watching this, hopefully this is a call to action to, have those conversations at home. Make sure you're applying sunscreen as appropriate and see
Hmm.
a dermatologist like Dr. Trisha. I mean, this has been, we're forever grateful for the time you spent for us. And, our ambition, if we can get just one man to act, it was well worth the time. So thank you so much for this.
Yeah. It
Yeah, and
sounds like a great organization that you have.
in the hope we can send some more people to your practice. Where's it at again?
Dermatology specialist of Omaha, just on 96th Street north of Dodge. And then our second location is on 204th Street north of Dodge. And that opens September 1st.
Awesome.
Yeah.
Thank you.
Yeah. Thanks so much for having me. So get your broad-brimmed hat and your lotion type sunscreen for your next trip. Okay.
We'll do.
We can do that.